have Alexee in this bathroom. Okay, we're going to backtrack. We've already talked about all the care that she got from Dr. Vasquez. While she's in the bathroom, what happens? Well, the facts of the matter, what we know to be facts, is that she delivered a baby. She delivered the placenta. The umbilical cord was separated at the placenta. She attempted to clean up the mess. We do know from the statements and testimony of medical examiner that she also attempted to clean the baby. We know that she put the baby in a garbage bag. According to her, she panicked and put the baby in the bag and cleaned up as much as she can, and then comes out of the bathroom and doesn't say anything to anybody. Now, let's go ahead and dive a little bit deeper into this. What I see, a few things that are going to come up in court and kind of like break all this stuff down. Yes, she put a baby in the garbage can. The charge right now is first-degree murder. They would have to prove that there was a crime and that she tampered with that evidence in order to be charged with all of the stuff that she's currently being charged with. She's not being charged with improper disposal of a corpse. She's not being charged with any of that. She's currently being charged with murder. And so one thing that I noticed from the photos of the garbage can is that all of the paper towels in there seem to be just, they have some light blood on them. One of them might have, some damp blood, but none of them have bright red fresh blood on them. None of them. Which tells me that all of the napkins that she used to clean up the floor, all of the napkins, the fresh blood, all of the napkins she used to wipe herself, all of the paper towels she used to clean everything else up were flushed down the toilet. None of those are in the garbage can. I have a theory of those paper towels that were in the garbage can, but I'm not going to put that out there right now because a lot of people are just like, oh, whatever. But remember that anything that's bright red or fresh like that, none of that was in the garbage can. So this, according to her, this baby just comes out. It wasn't breathing. It wasn't crying. It wasn't moving. She picks the baby up. She puts it down. The staff said that there was like a cabinet or something there. Maybe it was the sink, because she puts the baby down somewhere and she attempts to clean this baby off, and the baby was fairly clean according to the medical examiner. What we don't know is, did she then turn around and try to give this baby a breath? If she did, we now have air in this baby's lungs, the air sacs, and we have a little bit of air in the belly. I believe that that's exactly what happened, that she did that and she freaked out. She is now looking at a dead baby. And immediately she thinks it's her fault. She didn't know she was pregnant. Maybe all these things come flooding back. She's been taking medication. She's been cheering. All the stuff. She's 19 years old and naive. And immediately she's probably thinking, oh my God, this is my fault that this baby's dead. What are they going to do to me? I'm going to get in trouble. I'm so scared. I don't know. And she puts a dead baby in this garbage can. A dead baby. Not a live one. A dead one. And there's questions on whether or not the baby, there's another clean liner up top. These are pretty big garbage bag liners. They usually use these full-size ones, and then, you have all this extra slack. I personally believe that when she put the baby in there, the baby obviously goes to the bottom. Some of that bag, when you have a lot of bag and it just kind of sinks in, and there's still some up top. So that way when it looks, with the baby being heavy and kind of sinking the bag down a little bit, when they first look, that's all they see. They don't really see it. Looks like a clean liner up top. There were some other kind of liners and different things in there, but there was a couple of rolls of bags in there. It was a whole bunch of things. Maybe she did take a couple off and throw it in there. I don't know. We don't know any of that for sure. But yes, I agree with the fact that it's safe to say that she wanted to hide what just happened. She did not want to kill a baby. She wanted to hide the fact that there was a dead baby there. She thought she was going to get in trouble. She thought it was her fault. She panicked. In her mind, she wasn't thinking that they could bring this baby back to life. This is a dead baby. Who knows how long that baby was already dead for. We don't know if the baby died in utero. We don't know if it died when, hit the toilet when she gave birth. I mean, that sudden jolt there should have caused this baby to gasp or cry or something, and it didn't. Mind you, people are outside saying that they can hear an electronic paper towel and they can hear toilet flushing and water. They can hear everything else, but nobody ever heard a baby crying. They went in there immediately, and nobody heard a baby moving. They hung out in that bathroom. Nobody heard the baby moving. In the garbage can, nobody heard a baby gasping. None of that happened. So Alexee walks out and she doesn't say anything to anybody. Nobody. She just walks right back to her room. She probably walks completely, and she's in shock now. And on top of that, people are like, oh, she should have thought about this. And didn't she realize other people could have helped? She has drugs in her system, and she has blood loss. She has altered mind, state of confusion, all of this stuff going on. There's no way this girl is making any reasonable choices right now. There's no way she's thinking clearly about anything. And that's just the facts of the case. And that is going to come out in court. This altered state of mind, that he's going to break down all of the things that could have been going through her mind. He's going to break down all of the ways that her mind was not functioning properly to even make any correct choice, except for there's a dead baby and panic. Honestly, is that the right choice? Absolutely not. Is it something that you can understand and reasonable for what she was going through? Absolutely. It absolutely is. And, any person in a normal state of mind would probably not think that, but understand that she wasn't in a normal state of mind. I'm going to try not to make these videos like 10 minutes long, but just long enough where people could just listen to them, comment if you want. But I'll go into the next section, and the next part we're going to talk about the medical staff and what they did with the baby or lack thereof, and kind of how that scene all played out.